diabetes-friendly avocado meal plans that keep your blood sugar stable. After 60. Picture this. Margaret, a 67-year-old grandmother from Ohio, sat in her doctor's office. The words type 2 diabetes hung in the air. She felt overwhelmed, scared. She thought she'd have to give up every food she loved. But what if I told you there's a creamy, delicious superfood sitting in your kitchen right now? One that can actually help stabilize your blood sugar while making your meals more satisfying than ever. I'm Dr. David Walker, a senior health and nutritional wellness expert, with over 30 years of experience helping older adults not just add years to their lives, but add life to their years. Today, we're exploring something that might surprise you: how avocados can become your secret weapon in managing diabetes after 60. You'll discover why this green powerhouse has almost zero impact on your blood sugar. Learn 3 simple meal formulas that keep your glucose steady all day long. And get practical tips for creating diabetes-friendly meal plans. Plans that don't sacrifice an ounce of flavor or satisfaction. Whether you're newly diagnosed or have been managing diabetes for years, this information could transform how you approach every single meal. Let's dive in. The science behind avocados for diabetes. Let me start with something that might shock you. Despite being creamy and rich, avocados actually help your body manage blood sugar better than most so-called diet foods. Here's why this matters for you. When you eat a typical serving of avocado, that's about 1 cup of those beautiful green cubes, you're getting less than 1 gram of sugar. 1 gram. To put that in perspective, a single slice of white bread contains 3 grams of sugar, and that's before you add anything to it. But here's where it gets really interesting. Avocados contain about 13 grams of carbohydrates, yet over 10 grams of that is pure fiber. Think of fiber as nature's blood sugar stabilizer. When you eat high-fiber foods like avocados, your body breaks them down slowly, very slowly. This prevents those dangerous glucose spikes, the ones that leave you feeling tired, cranky, or worse. For seniors managing diabetes, this steady energy release is like having a built-in glucose monitor working in your favor. But the real magic happens with avocado's fat content. Nearly 19 grams of the 22 total grams of fat in avocados are monounsaturated fatty acids. These are the same heart-healthy fats found in olive oil. Research published in the Journal of the American College of Nutrition shows something fascinating. These fats don't just avoid raising blood sugar, they actually help your body use insulin more effectively. Sarah, a 72-year-old client of mine from Arizona, discovered this firsthand. She started adding half an avocado to her breakfast routine. Within just 2 weeks, her morning blood sugar readings became predictable. "I thought adding fat to my meals would make my diabetes worse," she told me, her voice filled with relief. "But my numbers have never been more stable." Here's something else that makes avocados unique for diabetes management. They have what nutritionists call a second meal effect. Picture this. When you eat avocado with other foods, particularly carbohydrates, it slows down the absorption of sugar from those foods. It's like having a natural time-release mechanism for your meals. The glycemic index measures how quickly foods raise blood sugar. White rice scores 89. Even whole wheat bread hits 69. But avocados? Just 15. This incredibly low glycemic impact means you can enjoy avocados without worrying about sudden glucose spikes. No more disrupted energy levels. No unexpected medication adjustments. For older adults, there's an additional benefit that's often overlooked: satiety, that feeling of comfortable fullness. A study in the Nutrition Journal found something remarkable. People who ate half an avocado with lunch felt satisfied for up to 5 hours afterward. 5 full hours. When you're managing diabetes, Controlling hunger without resorting to sugary snacks is crucial for maintaining stable blood sugar throughout the entire day. Always consult your doctor before making significant dietary changes, especially if you're taking diabetes medications. Your insulin or medication needs might change as your blood sugar control improves. The potassium content in avocados is impressive too, about 975 milligrams per cup. That's more than a large banana. This supports healthy blood pressure, which is particularly important. Diabetes and high blood pressure often go hand in hand. Many of my senior patients find that incorporating avocados helps them manage both conditions more effectively. But here's what really excites me about avocados for diabetes management. They make healthy eating enjoyable again. Too many diabetes meal plans focus on restrictions, what you can't have, what you must avoid. Avocados are about abundance, creamy texture that melts on your tongue, rich, buttery flavor, and incredible versatility that keeps meals interesting. Robert, a 69-year-old retired teacher from Michigan, put it perfectly. This breakfast combination kept my blood sugar readings between 120 and 140 for 4 hours straight. He paused, shaking his head. That's a vast improvement from the 180-plus spikes I used to get with cereal and juice. What specific meal combinations work best? That's exactly what we're exploring next. 3 diabetes-friendly avocado meal formulas. Now that you understand why avocados are so powerful for blood sugar control, let me share 3 proven meal formulas. These aren't just recipes. They're flexible templates you can adapt to your taste, preferences, and dietary needs. Templates that my senior patients have used successfully for years. Formula number 1. The Steady Start Breakfast. This combination has helped hundreds of my patients start their day with stable energy. Take half a medium avocado, mash it gently with a fork, spread it on 1 slice of whole grain bread. Make sure that bread has at least 3 grams of fiber per slice. Top with 1 sliced hard-boiled egg. Sprinkle with everything bagel seasoning, or a pinch of sea salt. Why does this work so beautifully? You're getting approximately 15 grams of carbohydrates from the bread. But here's the key. The 5 grams of fiber from the avocado plus the 3 grams from the bread slow down absorption significantly. The egg provides 6 grams of high-quality protein. This further stabilizes blood sugar release. You can customize this formula endlessly. Try smoked salmon instead of egg for omega-3 fatty acids. Add sliced tomatoes for extra fiber and antioxidants. Use sprouted grain bread for even better blood sugar control. The key is maintaining the ratio: healthy fat from avocado, quality protein, and complex carbohydrates with plenty of fiber. Formula number 2. The Balanced Bowl Lunch. This is my go-to recommendation for seniors who want something substantial, something that still keeps blood sugar steady. Start with 1 cup of leafy greens. Spinach, arugula, or mixed greens work perfectly. Add half a diced avocado, 3 ounces of grilled chicken or turkey, and 1/4 cup of cooked quinoa or brown rice. The magic happens in the proportions. You're following what nutritionists call the diabetes plate method. Half your bowl is non-starchy vegetables. 1/4 is lean protein. 1/4 is complex carbohydrates. The avocado provides healthy fats that tie everything together, while keeping you satisfied for hours. Dress this with a simple vinaigrette. Olive oil and lemon juice work perfectly. Avoid store-bought dressings that often contain hidden sugars. This combination typically provides about 25 to 30 grams of carbohydrates. But with 12 to 15 grams of fiber and 35 grams of protein, your blood sugar response will be gentle and sustained. Linda, a 74-year-old grandmother from Texas, uses this formula for Sunday meal prep. She makes 5 bowls at once. varying the protein between chicken, turkey, and hard-boiled eggs. My afternoon energy is so much better, she reports with a smile, and I don't get those 3 p.m. crashes anymore. For vegetarian options, replace the meat with a palm-sized portion of tempeh or tofu, or try a half cup of cooked lentils. Each provides similar blood sugar benefits while meeting different dietary preferences. Formula number 3. The comfort dinner. Evening meals can be tricky for diabetes management. Your body's insulin sensitivity naturally decreases later in the day. This formula addresses that challenge. It emphasizes protein and healthy fats while keeping carbohydrates moderate. Start with 4 ounces of baked salmon, cod, or another fatty fish. Add half an avocado, either sliced alongside your protein or mashed as a simple guacamole. Include 1 cup of roasted non-starchy vegetables. Broccoli, Brussels sprouts, or asparagus work wonderfully. Complete the plate with a small portion of sweet potato or wild rice, about 1/3 cup. This combination provides sustained energy without causing late evening blood sugar spikes, the kind that can interfere with sleep. The omega-3 fatty acids from fish combined with the monounsaturated fats from avocado create an anti-inflammatory effect. This is particularly beneficial for seniors managing diabetes. Helen, a 71-year-old client from Florida, used these 3 formulas in rotation. Within 6 weeks, she reduced her average blood sugar by 30 points. I don't have to think about what to eat anymore, she told me. I just follow the pattern, and my numbers stay steady. What makes these formulas so effective? They're based on the principle of nutrient timing and combination. By pairing avocado's healthy fats with quality proteins and complex carbohydrates, you're creating meals that support stable blood sugar for 3 to 4 hours. Exactly what your body needs to maintain energy and prevent unhealthy snacking. The beauty of these formulas is their flexibility. Hate quinoa? Try cauliflower rice? Don't eat fish? Lean beef or poultry works just as well. The key is maintaining the basic structure. Healthy fats, quality protein, complex carbohydrates, and plenty of fiber. Are you wondering how to turn these individual meals into a complete weekly plan? Let's tackle that practical challenge next. Practical meal planning and prep strategies. Creating a weekly meal plan that consistently supports healthy blood sugar might feel overwhelming, but I'm going to share the exact system I've taught to hundreds of seniors. A system that makes it simple and sustainable. The secret isn't perfection. It's having a reliable framework that adapts to your lifestyle. The foundation. Weekly avocado planning. Here's something most people don't know. Proper avocado selection and storage can make or break your meal planning success. Buy avocados at different stages of ripeness. Some ready to eat today, others that will ripen over the next 3 to 5 days. A ripe avocado yields slightly to gentle pressure, but it's not mushy. The skin might be darker, but it shouldn't have soft spots. Store ripe avocados in the refrigerator to slow ripening. Keep firmer ones on the counter where they can ripen naturally. For meal prep efficiency, I recommend the half-time method. When you cut an avocado in half, use 1/2 immediately. Store the other half with the pit still in it. Wrap tightly in plastic wrap. Or store in an airtight container with a squeeze of fresh lemon juice. This prevents browning and keeps it fresh for 1 to 2 days. The 3-day rotation system. Instead of planning 7 completely different days, plan 3 distinct day types. Rotate them throughout the week. This reduces decision fatigue while ensuring variety. Here's how it works. Day type A, comfort classics. Breakfast, avocado toast with egg, Formula 1. Lunch, balanced bowl with chicken, Formula 2. Dinner, salmon with roasted vegetables and avocado, Formula 3. Snack, quarter avocado with raw almonds. Day type B, international flavors. Breakfast, scrambled eggs with diced avocado and fresh salsa. Lunch, Greek-style salad with avocado, feta cheese, and grilled turkey. Dinner, lean beef stir-fry with avocado garnish. Snack, avocado slices with cucumber rounds. Day type C, simple and light. Breakfast, Greek yogurt topped with sliced avocado and fresh berries. Lunch, avocado, tuna salad, served over mixed greens. Dinner, grilled chicken breast with creamy avocado herb sauce. Snack, hard-boiled egg with avocado slices. Smart shopping and storage. Your success starts at the grocery store. Shop with a list organized by your 3-day rotation. Buy proteins in bulk to save money. Purchase pre-washed salad greens to reduce prep time. But avoid pre-cut avocados. They lose nutrients quickly and cost significantly more. Store proteins in portion-sized freezer bags immediately after shopping. 3 ounces of chicken, 4 ounces of fish. Measured portions of other proteins can be thawed as needed. This prevents both food waste and impulsive meal choices that might disrupt blood sugar control. For seniors with limited mobility or energy, consider these time-saving strategies. Buy pre-cooked rotisserie chicken. Use frozen vegetables that steam right in the microwave. Keep canned beans rinsed and ready for quick protein additions. Blood sugar timing considerations. Here's something crucial that many diabetes meal plans miss. When you eat matters almost as much as what you eat. For optimal blood sugar control, aim for consistent meal timing. Eat breakfast within 2 hours of waking. Lunch 4 to 5 hours later. Dinner 4 to 6 hours after lunch. The avocado in each meal helps create what nutritionists call glycemic stability. Your blood sugar rises gradually and stays elevated for longer periods. This prevents the hunger pangs that lead to poor food choices. Remember to monitor your blood sugar levels as you try these new meal combinations. Always work with your healthcare provider to adjust medications if needed. Your improved glucose control may require dosage adjustments, making it social and enjoyable. Don't underestimate the power of sharing your new eating approach with family and friends. Many of my patients find that cooking avocado-based meals becomes a social activity, one that their grandchildren actually enjoy. Teaching younger family members about healthy eating while managing your own diabetes creates positive connections around food. James, a 68-year-old from California, told me something wonderful 6 months after starting these meal plans. I used to dread grocery shopping because everything seemed off limits. Now I look forward to trying new avocado combinations. He smiled. My wife says I'm more fun to be around because I'm not constantly worried about my numbers. Consider joining online communities or local groups focused on diabetes management. Sharing meal photos and success stories provides motivation and accountability, the kind that supports long-term success. The goal isn't perfection, it's progress. Even implementing these strategies 3 days a week can significantly improve blood sugar control and energy levels. Ready to see how these individual strategies come together? Let's explore the life-changing benefits that my patients experience. I want to share something that goes far beyond blood sugar numbers and meal plans. It's about reclaiming joy in eating and confidence in your health journey after 60. 3 months ago, I received a call from Margaret, the grandmother I mentioned at the beginning. Her voice was completely different, lighter, more energetic, filled with excitement. "Dr. Walker," she said, "I haven't felt this good about food in years. My grandson asked for my avocado breakfast recipe for his college dorm." That phone call gave me chills, because that's the transformation I see repeatedly when seniors embrace avocado-based diabetes meal planning. It's not just about managing a condition. It's about thriving despite it. You're not just controlling blood sugar, you're taking control of your entire health story. Here's what really happens when you implement these strategies consistently. Your energy becomes predictable. No more afternoon crashes that leave you reaching for sugary snacks. Your sleep improves because your blood sugar isn't spiking and crashing through the night. Your mood stabilizes as your brain gets steady fuel throughout the day. But perhaps most importantly, you stop feeling like diabetes controls your life. Instead, you develop confidence. Real confidence in your ability to make choices that support your health, while still enjoying delicious, satisfying meals. Think about the grandfather who can keep up with his grandchildren at the park because his energy is steady all day long. The grandmother who can cook family dinners without worrying about her blood sugar. The retiree who travels confidently, knowing how to maintain healthy eating habits anywhere in the world. This isn't about perfection or never having challenges with diabetes management. It's about having reliable tools that work with your lifestyle, not against it. Every time you choose an avocado-based meal over processed food, you're voting for your future health. Every steady blood sugar reading is evidence that you can manage this condition successfully. Remember, these dietary approaches should complement, not replace, your prescribed diabetes treatments. Always work with your healthcare provider to monitor your progress and adjust medications as needed. Your age isn't a limitation. It's an advantage. You have the wisdom to recognize what works, the experience to stick with beneficial habits, and the motivation to prioritize your health. These avocado meal plans aren't just for the next few weeks. They're sustainable strategies you can use for years to come. The ripple effects extend far beyond your own health. When family members see you thriving, managing your diabetes confidently, and enjoying meals again, you become an inspiration. You're showing them that aging with diabetes doesn't mean giving up on vitality or pleasure in eating. Helen put it beautifully when she said, "My daughter used to worry about me constantly. Now she asks for my recipes." If you found this information helpful, don't keep it to yourself. Share it with someone you care about who's also navigating diabetes after 60. Hit that like button to let me know this resonated with you. Subscribe to stay connected with more evidence-based strategies for healthy aging. Ring that notification bell so you never miss new content that could transform your health journey. I want to hear from you in the comments below. Which avocado meal formula are you most excited to try? Have you already discovered ways that avocados help your blood sugar control? Share your experiences, because your success story might be exactly what another viewer needs to hear to take their first step toward better diabetes management. Your health journey after 60 can be your best chapter yet. With the right information, practical strategies, and delicious options like avocado-based meal plans, you're not just managing diabetes, you're mastering it. Every meal is an opportunity to nourish your body, stabilize your blood sugar, and invest in your future vitality. Take that first step today. Your blood sugar will thank you. Your energy levels will thank you. And your confidence in managing diabetes will soar. Remember, this isn't just about adding years to your life. It's about adding life to your years.